Why is clinical workflow analysis, process redesign, and quality improvement important to improving process outcomes? Presented to you by Allison Beffa, Beth Moore, and Michelle Raymond. Meet Charlie. Poor Charlie does not feel well. He has been extremely short of breath, not able to walk long distances, and his feet have really begun to swell. As tough as Charlie is, he just wants to feel better so he can return to the mine where he worked for the last 37 years. His wife and children are worried about him, so they drug him to the emergency room. That bought Charlie a short stay at the hospital and the diagnosis of chronic obstructive pulmonary disease. The doctor told him that he is currently at stage 2 of the disease process. Charlie knows he needs to stop smoking, exercise, and eat better. He just doesn't know how. Poor Charlie. So what is clinical decision support? Clinical decision support organizes patient information in a way that health and healthcare delivery can be improved. Data is just data if it is not organized in a methodical way. Organizing the data enhances decision making. Clinical decision support systems intersect nursing practice every day. It happens so frequently you probably do not even realize the wizard behind the curtain organizing the data. It is reasonable to assume if a body of knowledge or data is organized in a logical way, nursing should utilize it to improve patient care. Clinical decision support systems help to automate decisions through logical and orderly categorization, with the ultimate goal to improve how nurses arrive at those decisions. Today, there is so much data available, it can be overwhelming. Examples of how data can be logically organized and used for clinical practice are use of barcode scanning in medication administration, sepsis alerts in the electronic health record that link clinical assessment data and laboratory results. Sensmeyer further helps us to understand what a clinical decision support system is by comparing these systems to the 5 rights. The right information. Is it evidence-based, suitable to guide action, and pertinent to the circumstance? The right person. Does it consider all care team members, including clinicians, patients, and their caregivers? Is it displayed in the right intervention format, such as an alert, order set, or documentation tool? Is it available through the right channels, through an EHR, personal health record, website, or mobile application? Is it accessible at the right time in the workflow? Applying clinical decision support systems to Charlie, we know from our nursing assessment there are several data elements defining Charlie's present condition. All the information in a standalone system is overwhelming for Charlie, his family, and his care team. But as we utilize clinical decision support systems, we can tailor the education Charlie and his family needs to make the healthy change he is wanting. Clinical workflow analysis evaluates the flow of a specific concept or process. Components to include users, information, resources, policies, and external environment. Next step is to develop a workflow model. This model needs to be accurate and illustrate key pieces of functionality of the work that is being reviewed. According to Saba and McCormick, there are 2 ways to develop the model: interview and observation. Interview is talking with the individual or group to review each step of the process so that it can be mapped out. Observation is watching the process so that key pieces of the workflow can be identified. The best approach, however, is to do a combination of the 2 to ensure key players and steps are not inadvertently left out so that the model is an accurate reflection of current workflow. There are several different frameworks to use with workflow analysis, but we will focus on patient-oriented workflow. In this framework, the patient is core. Multiple disciplines will be providing care and communication utilizing an interdisciplinary approach. This framework can be utilized within and outside of the acute hospital setting. For our patient, Charlie, he will be having the specialist, nursing, pharmacy, dietitians, radiology, laboratory, and his primary care provider all working to take care of his healthcare needs. What is evidence-based nursing practice? Evidence-based nursing practice is the process to make quality decisions and provide nursing care based upon personal clinical expertise in combination with the most current, relevant research available to improve the quality, outcome, and safety of patient care. Steps in the EBP. First, construct a relevant, answerable question from clinical practice. Second, plan and carry out a search of the literature for the best external evidence, including literature reviews, systematic reviews, meta-analysis, and evidence-based tools. Third, critically interpret the literature for validity, applicability, and reliability. Then, implement the evidence to your clinical practice. And lastly, evaluate the performance. Barriers to EBP. Barriers include environmental, behavioral, and personal factors. Environmental is the lack of institutional resources, support, and knowledgeable mentors. While behavioral and personal barriers refer to the lack of time to access reliable information, skills to identify whether information is reliable, and the inability to see relevance of research-based resources in an individual practice. Changes in environmental and personal barriers will impact behavioral barriers. Nurses need to focus on improvement and learning. This will help to ensure resources provided to patients, families, and providers are rooted in the most up-to-date evidence. Critical thinking and challenging current practice will solve some of the most complex problems. Process redesign is necessary when either gaps in performance occur, a new product or technology is introduced, and/or there is a change in workspace or personnel. Performance may include patient outcomes, satisfaction scores, time measurements, and utilization. Gaps may be identified by various sources such as evidence-based practice, benchmarking, daily workflow, and patient complaints. Oz Kanaki identified three primary process designs: system analysis, socio-technical principle for redesign, and systems engineering initiative for patient safety. Today, we will be focusing on the latter. This theory was originally funded by AHRQ. This framework focuses on the work system, the process, and the outcomes. Work systems are divided into 5 categories and focus on how they interact with each other. The 5 categories are person, technology and tools, organization, tasks, and environment. The process relates to care processes and other processes such as information flow and process improvement activities. Outcomes include both employee and organizational outcomes in addition to the patient. Figure 1 illustrates the flow from work systems to the process to the outcomes. Regardless of which framework you utilize, the key to process redesign is to apply a systematic approach to maximize the ability to achieve the desired patient or process outcome. Continuous quality improvement. Next step is to identify the QI model that will be used to evaluate the process change. Examples of QI model includes PDSA, Lean, Six Sigma, and FMEA, Failure Mode and Effects Analysis. We will be focusing on the PDSA cycle. Plan, Do, Study, Act. PDSA, also known as the Deming Wheel. This is used with complex processes to initiate and evaluate change. It provides a foundation for continuous quality improvement. In addition to being its own QI model, it is also the foundation of several other QI models being utilized throughout the industries. Utilizing the Plan, Do, Study, Act process, plan to identify the plan or process that you are changing. Do is completing the pilot testing for the change. Study to review and evaluate the data obtained from the pilot. Act is the time to decide if you are going to adopt the change or make adjustments. If adjustments are needed, you start the PDSA cycle over again. In conclusion, you can make a difference in the life of many Charlies by knowing how to sort disparate pieces of information, mapping those individual pieces of information on how they revolve around the patient or workflow, analyzing the patterns, and seeking the evidence-based practice and applying the knowledge or data of your patient population to improve outcomes. All the while, your goal is to improve the quality of life and outcomes for our patient Charlie. Thank you for listening to our presentation. We hope that you have a better understanding of the processes that we discussed today. Our references are listed for your review.